Bit about medical tourism when it comes to stem cell therapy. In the 2016, 2017, when I first got started, the big clinic to go to was Panama for the high dose stem cell IV. And since then, a lot of labs have popped up since 2019, 2020 for the high dose stem cells. And I'm talking specifically for the umbilical cord derived stem cells. So people were flying to Panama when I first started doing stem cell therapy here in Phoenix. And now there's a lot more choices here. So you don't have to fly to Mexico or Panama or Colombia. I'm aware as a physician of all the marketing to us, to the clinics for seminars, to join a marketing group, a marketing group that takes a percentage. So I joined this group and they put on a seminar. They get the people for me, the leads. They put on the seminar and get a percentage of every patient I get from that. To me, I don't feel ethical joining that kind of marketing program because I don't get to choose the stem cells. They choose kind of what that's going to look like as far as the product. So when it comes to quality control and safety, I want to, as a doctor, be in control of what type of stem cells I'm going to work with and the supplier, more importantly. So using an FDA supplier that isn't sponsoring a marketing program is my path in medicine. And I do warn patients when I'm doing the complimentary consultations is, yes, it includes, maybe the plane ticket and a hotel room and a black car, but what are we paying for here? I mean, are you after a vacation or so the money, so when they're looking at what's included, I'm not in the business of tourism and vacations. I'm in the business of giving you the highest quality stem cell treatment. So most of the time my treatment is less, but no, I don't include the hotel room and the flight and the car because you're coming to Phoenix, Arizona, you're not flying to a different country. And going outside of the United States or going outside of an FDA registered lab means that you're going to be given expanded stem cells, meaning cloned stem cells that did not come from the umbilical cord. They were cloned from other stem cells. So they're not the original stem cells. Expanded stem cells have been shown, I have the studies, have been shown to have less ability to differentiate and proliferate. So the proliferation is what you want. That's what you're paying for, is the division cycles that will happen in your body. So when you get the original stem cells that were not cloned or cultured in a petri dish, you're going to have more of a potent treatment. So the money I'm charging is going towards potency, not a car, not a hotel room, not a flight, not a beach. That's on you. Phoenix is a beautiful place, especially if you come from the Midwest or Canada in the winter. It does feel like you're on vacation. And we do have a lot of treatments in office, and sometimes I run promos, and I'll include a plasma medbed treatment, which is a Tesla type medbed treatment. I believe there's only 5 or 6 in the nation. I'll have to check. But some of the treatments that the medical tourism clinics offer are available everywhere. Red light bed is very common, hyperbaric oxygen, it's not that special. So I try to give you the best deal, but I'm not going to sacrifice safety, efficacy, and potency. I really enjoy my follow-up calls with my patients, whether it's an autistic child or a vaccine adverse event, long COVID. I'm just excited every time I get off the phone because it's just such dramatic results. Low back pain, patients are able to sleep again. So that's what you're paying for, is results, and not having to also get more than one IV most of the time. So when it's weaker stem cells, expanded stem cells, plan on maybe flying back down to get a couple more treatments. But depending on how advanced your condition is, one treatment may just do it. And of course, I follow every patient for 6 months, including dietary and supplement advice to power up those stem cells, along with frequency medicine that I mentioned, like the Therify bed. So use caution when engaging with the medical tourism side of regenerative medicine. As a physician, I choose not to take up the offers of these seminar groups who want to give me leads. I see that as an unethical way to do business as a medical practitioner. Thank you, and if you want some more information, click on the link below and contact my office for a complimentary consultation.